Good afternoon, everyone.
Good afternoon.
And indeed, I'm very, very happy that after this presentation, you all did not move. I say that, and I'm going to digress for just a second, because if anyone knows me, know that I'm proud to be Caymanian. I am extremely proud to be serving in this noble role as your country's Minister of Health and Wellness, and I have to include Home Affairs. But there was something sitting in that chair and reminiscing, as Ms. Beverly spoke about, we had a chat last night. It's just by chance I was on YouTube on Tuesday night, and there was a live town hall meeting in another neighboring jurisdiction. And I'm hearing how much we have given freely in our country that I actually got cold chills. This particular town hall meeting, someone got up and said, when will we be able to offer breast cancer screening to our people? I was shocked. It didn't just stop there. The person making the statement, long before a question, went on to say that that particular jurisdiction had the highest rate of breast cancer per capita in the world. It's an island. Only to hear that wasn't the only high rate of cancer. They included prostate and colon cancer. To anyone hearing the sound of my voice, we have to give thanks for you and the people of the Cayman Islands. We have to give ourselves a round of applause. These NGOs, looking at all of these sponsors who've made this event possible, and you're sitting there, well, me on my smart device, and there are people that will never ever, not even from a public health standpoint, would be able to get breast cancer screening unless they can pay for it. And these are our brothers and our sisters and our neighbors. And for what we take for granted here, something like that would be like hitting a jackpot. I say we give thanks. But as we draw this enlightening 15th annual healthcare conference to a close, I stand here before you filled with, honestly, a sense of hope and determination. Because since Thursday, we have explored the intricate threads that weaves together our healthcare ecosystem, from an informative technologies and policies to the critical role of community engagement. Community engagement that allows us to be informed, get a better grasp on knowing the state of Cayman's health, because we now have local data. And we are well informed, and this data has been collected and collated and has been analyzed, and yes, as your flyers and booklets say, the results are in. Do we like what we see? Well, what I see as your minister is that collectively we got work to do. And we can do better. And the forecast for the future, quality of life for so many, will not be good. But we all, every one of us, must do our part. For a point of emphasis, and to repeat, 35 of Cayman's residents are walking around right now with elevated blood pressure, and they're oblivious. It's just how I am. It's just that stiffness in my neck, maybe, because of the poor chair that my employer is not providing me with. We find every excuse because, for some reason, life is moving so fast, they are undiagnosed. 50% of our residents who know they have diabetes, that they are diabetics, have never had a foot exam. But yet we go and we do our manicures and our pedicures. We go and we purchase birthday vouchers and gift cards. Mother's Day, for Father's Day, for just those special celebrating moments. Why not shift our thoughts and our ideas to considering getting a gift voucher for a foot exam? That would be something you would think of, right? It would be the smart thing to do. But then you wonder, where do I go to get it? You're not thinking of your doctor's office. Is your manicure or your pedicure specialist the person to go to? Or do I really want to go to a facility where I know I can get this done? I'm saying all of this because, like I said, we need to do a bit more in informing and educating our populace. 7 in 10 Caymanian residents are overweight. They're obese. And 35% have never had a cholesterol check. Christmas is coming. I heard them talking about turtle meat the other day, shortage. That may be a good sign. But at the end of the day, we all have the data that is here. You can no longer say it's information from a different country, another man, because of their ethnicity. We know that the information we have that is in the public's domain is Caymanian. And the Cayman Islands, as I said, we are such a blessed country. We have so much that we have been blessed with. And the very share of size of our population with the proper buy-in, support, collective approach, and a sense of responsibility to ensure that everyone has access to quality health care, we can prove so much to the world, and by extension, have a more wholesome life with family and friends, but we must do it together. Our discussions have emphasized that robust healthcare systems is not merely the sum of its parts, but an interconnected network that thrives on collaborations and shared goals. And we have heard from experts and practitioners, shared best practices, and examined challenges that we face together. The insights gained here will undoubtedly pave the way for transformative changes in how we deliver care and support the health of our community. Let me urge each of you to take the knowledge you have acquired and implement it within your spheres of influence. Let us commit to fostering more partnerships across sectors, embracing innovation and prioritizing the well-being of every individual in our care. By working together, ladies and gentlemen, we can create a sustainable healthcare ecosystem that is equitable, efficient, and most importantly, resilient. I want to extend my heartfelt gratitude to all of our stakeholders and to our sponsors, organizers, and to each of you for your active participation. It would not go without saying special mention to our overseas sponsors and participants. That speaks volumes to your interest in our Cayman Islands. And I wish you safe travel back to wherever you call home. We look forward to building relationships moving forward. And also, let me reiterate, huge thanks go out to the Ritz-Carlton and their entire team. Kelly Holding, my chief officer, Ms. Nellie Pucci, and her team, thank you all. HSA Board of Directors, and to all of the HSA's volunteers, thank you. Dedication to improving healthcare is inspiring and essential for for our collective success. As we move forward, let us carry the momentum from this conference into our daily practices, advocating for policies that support health equality, investing in research, and promoting wellness within our communities, because together we can realize a brighter future for health and wellness. Thank you for your commitment. Thank you for your passion. Thank you for your invaluable contributions. Safe travels home, and let us reconvene invigorated and ready to make a difference together. Thank you, and enjoy the rest of your weekend.